pandemic. We know very well that it's airborne and that ventilation is crucial. And we still don't have CO2 monitors in every classroom across the state. And according to what the Minister just said, we're almost finalised, and therefore there isn't even a plan to have CO2 monitors for every classroom across the state. Why are we scrimping and saving on children's health? Why aren't we ensuring there's CO2 monitors in every classroom, HEPA filtration systems where necessary, especially considering the moves that are being made in terms of contact tracing?
Managing ventilation is just one of a suite of public health measures in place to keep our schools safe. Updated guidance for schools and practical steps for the deployment of good ventilation practices in schools was provided at the end of May, following the work of an expert group that carefully considered the role of ventilation in managing COVID-19. A copy of the guidance is published on the gov.ie website. The overarching approach in the guidance is for schools to have windows open as fully as possible when classrooms are not in use and partially open when classrooms are in use. The guidance outlines that carbon dioxide monitors can play a part in providing a useful general indication that areas or rooms may not be adequately ventilated. They can enable occupants to become familiar with the impacts of activities, outdoor weather and window openings on levels of good ventilation. The Department procured portable monitors, as was recommended, that are currently being distributed to schools between 2 and 20 at primary school level and between 20 and 35 at post-primary school level, depending on school size, at an estimated cost of £4 million. The monitors are portable, simple to use and will give a digital reading. The provision of portable CO2 monitors provides schools with the flexibility to focus their use to those rooms which are most benefit to inform strategies for optimising ventilation in the school. Deliveries of CO2 monitors in schools commenced in the third week of August. In total, it involves over 35,000 CO2 monitors being distributed to primary and post-primary schools. 25,000 CO2 monitors have been distributed to schools, which has facilitated monitors being provided to each school. 96% of primary schools, including all special schools, have received their full allocation of CO2. 10 CO2 monitors have been provided to schools at post-primary level, with the balance of their allocation expected to be distributed in October. As I've said earlier, schools do have the option, should they wish, to purchase them locally rather than drawing down from the central framework. Equally to say, in reference to your scrimping in terms of expenditure in schools, over 635 million has been allocated for COVID measures within our schools this past year, and indeed 57 million for this first term alone. There has been no question of scrimping in the school sector for COVID measures.
Thanks. It's a policy decision by the government not to provide a CO2 monitor for every classroom in this state. That's a scandalous policy decision. It's a policy decision by the government not to provide HEPA filtration systems when necessary. To make our schools reasonably safe in terms of ventilation would cost €10 per child, and the government chooses not to do it. I was speaking to a principal yesterday who precisely had to go down the route that the Minister advocates, which the Board of Management had to go and buy their own CO2 monitors in order to have an adequate number. Children are at the most risk of COVID at this particular moment. It seems that the policy of the government is to allow COVID to run riot through children. The consequence of that, if it's followed, will be a small but important proportion of unvaccinated children ending up hospitalised, and very importantly, up to 10% of those who get it could end up with long COVID.
Deputy, I would have to disagree with much of what you have said. It was the expert view of the expert group under Professor Wenger that portable CO2 monitors would be provided. And you should be mindful that monitors are just that. They monitor when it's best to increase ventilation, which might be opening windows additionally, open doors, or whatever the case might be. But they are just an instruction, and that's all that they do. And indeed, I want to acknowledge that within the school sector already there is excellent best practice, and indeed Professor Wenger himself also commented upon the excellent guidelines that were provided for schools. So it was envisaged that these monitors would be used as a spot check, and that's why they're portable and that they can move from room to room. Specifically in relation to air filters or any additional measures that might be required, the Department is prepared and is working with schools. If there are any additional measures that are required to increase ventilation, minor works can be used to do that, or indeed the expertise of an engineer or architect can be provided either locally or from the department. And if that work is necessary, that work will be carried out by way of emergency works. And indeed, if in the short term air filters are required, that will also be required. that will also be put in place.
The change of policy in terms of close contact tracing does not make sense to me. So if you have a situation where a child goes to a birthday party for half an hour, they are counted as a close contact and they have to be tested. Alternatively, if they're in school for a week in the same pod as another child all day, every day for a week, now all of a sudden they don't count as a close contact. It's hard to avoid the conclusion that this is a kind of hear no evil, see no evil, speak no evil approach. If we don't test children, then we won't see just how widely COVID is running through our schools. It seems that it's a decision that will have quite negative consequences if it's not reversed. Parents should obviously be facilitated, their lives shouldn't be made more difficult, facilitated to get children tested. But the idea that we just turn a blind eye to COVID transmission that is happening in the schools and treat them as some sort of magical place where transmission doesn't happen doesn't make any sense.
Minister, to conclude.
There is absolutely no question of a blind eye being turned to anything within our schools, and indeed I want to be very clear that all of the mitigation measures as recommended by Public Health are currently in our schools and remain in our schools despite what might be happening in wider society, and those measures are rigorous measures. And indeed the advices that have been offered yesterday are the best expert medical advice of the CMO and NEFIT, who collectively have reviewed all of the population data in terms of the cohort of children under 13 years of age, and it is their expert view that the reopening of schools has not led to an increase of COVID-19 among school-going children or more widely across the population. Indeed, they would point, and I have discussed this with Professor Philip Nolan, who is doing the modelling, as you're aware. It is their expert view, for example, that prior to schools returning, the positivity level amongst children under 13 years of age was at 15%. On the return to schools, that is now at 5%. So these measures are being introduced on foot of expert data analysis and indeed the advices of the CMO, Dr. Tony Houlihan himself, and NEFIT.
Thank you, Minister.